I'm CEO of Panintelligence, and we're a data analytics software business based in Leeds by Leeds Bradford Airport, actually behind the Murgatroyd's Chippy, if you know that area of Leeds well. I want to talk to you very quickly about data and the power of data really to create a huge amount of social good and change, and too long have the tools and the technologies to be able to take data and do things with that for changing outcomes have been in the hands of those of the few and those with the power and the money to do something with it. And we're very much an organisation on a mission to change that and enable everybody to be able to make changes through data and change outcomes for good. And I'm going to give you a couple of examples today, one in health and one in environment. And unsurprisingly, I think the one that we need to talk about, because we're all watching every day with a level of concern but interest in the data outputs that are coming from the cases worldwide. And we are all part of quite a large social experiment, really, to be quite frank, in taking interventions such as social distancing and isolation to improve and change the outcomes for so many by the small actions that we do. And essentially this is predictive modelling at the largest scale that anybody can possibly imagine. But this isn't new. This is proven, and the reason it's proven because if we've been here before, and data tells stories of patterns and trends of things that happen over time. And in 1918, the Spanish flu pandemic was a huge story across the US, with death rates similar to that we're seeing here in the cases that we have with the coronavirus. And as you can see with Philadelphia, there was a massive spike of cases which resulted in the things that we're trying to mitigate against right now. And why did that happen? Well, 8 days after the pandemic, they decided to have the largest ever social gathering in the city, a huge celebration that resulted in that spike. And it's because of these things, and because of history, and because of data, and because of patterns, we're able to really take interventions and make social changes that have the outcomes that we can be confident of. And that's what we're in the business of, really. We're in the business of helping everybody take the power of data and to be able to understand why things are happening, and then track those patterns, predict outcomes, and work out how they can intervene to make real change, real impact, social impact. And we do that in education, healthcare, public sector, to really enable organisations to do positive things with data. At the moment, we're obsessing. I mean, this is our software. It's a screenshot over the things around data that everyone's being presented. You'll see that we track very closely, unfortunately, to the trend that Italy have mapped. In fact, we're only 15 days behind Italy, which is a sobering thought, really. But let's just stay with that for a minute, because yes, this isn't great for everybody right now, but actually we can start to do some positive things with that. So if we think about localized information, let's think about Yorkshire for a second. Yes, we have 66 million people in the UK, and it's only 0.3% of cases, but we know that we're trying to avoid this spike. We can also see that Sheffield in particular has a high volume cases, and Sheffield City Council approached me today through somebody we know there, because they're desperate to have some software that help them to manage data, and we're going to support them with that and give them it free and enable them to do things to get the appropriate care and interventions to the most vulnerable in the city. But if you take that sort of information and map that to capacity, so this is ICU beds in all of our regional hospitals, and we know how many people demographically have underlying health conditions. We know how many people locally are over the age of 70. We also know how many beds there are. We know the trends and patterns of cases. We can start to predict those pinch points, and we're working with rostering and scheduling, data capture providers. We're taking demographic data, case data, and ICU bed capacity. We can start to really predict when people are going to need those staff, those resources, those ventilation equipment at the point that they need it most. And that's the power of data, is we can really start to do things, but we have to do it quickly. So for us as a business, we have the software, we have the people, but we don't always have access to the data that can make the real change. And I imagine many of you do have those contacts, and listening to Stephen and some of the amazing projects they're working on. But data is at the heart of being able to make these real changes. So from my point of view, if you know anybody that has an amazing amount of data that we can enable, we'll give you our tech. Have it, take it, we'll enable you, we'll train you, we'll give you the support you need to turn that into real change. But let me end on something positive, because it's not all doom and gloom. And the environment has been a huge conversation over the last 18 months. And we as an organisation have simply been tracking the benefit of actually being at home. you know, how much CO2 we've saved, how much less time we're traveling. And this is just all of our staff, and we're mapping that. And, you know, there's got to be some good we focus on from all of this. So data can be a force for good, a force for change. And we're looking for anybody that needs support with our technology and what we can do to enable some kind of interventions that make a real difference. So that's all from me. Thank you very much.
Wow, thank you very much, Zandra. So a clear ask there from yourself around if anybody knows of any great data sets and can enable some of that, then get in touch.